The Prime Minister has called for a careful loosening of coronavirus restrictions, but added that lifting them should be permanent. Boris Johnson plans to unveil a roadmap out of lockdown in a week from now, but he warned that infections were still too high to make any rash decisions ahead of a press conference expected this afternoon at 5.
We've got to keep looking at the data. We've got to keep looking at the rates of infection. Don't forget, they're still very high, still 23,000 or so in COVID patients in the NHS, more than at the April peak last year. Still, sadly, too many people dying of this disease. Rates of infection, although they're coming down, are still comparatively high. So we've got to be very prudent. And what we want to see is progress that is cautious but irreversible. I think that's what the public and people up and down the country would want to see.
There are already reports of what the Prime Minister's reopening could look like. Primary and secondary schools are scheduled to recommence classroom learning from March the 8th after getting the backing of scientific advisors. The next stage could see friends and family be allowed to meet outside on a one-to-one basis. Plans are also expected to allow children to meet vaccinated grandparents over the Easter holidays in early April. And later in April, non-essential retail could be allowed, followed by a limited amount of hospitality, such as outdoor drinking and dining. But there are still few details on exact timings, with the Prime Minister facing pressure from more than 60 lockdown sceptic MPs to lift all restrictions by the month after next.
COVID is a serious disease and we must control it. However, just like COVID, lockdowns and restrictions cause immense social and health damage and have a huge impact on people's livelihoods. The vaccine gives us immunity from COVID, but it also must give us permanent immunity from COVID-related lockdowns and restrictions.
To discuss what the lifting of lockdown may look like, I'm joined by expert in communicable diseases, Dr. Bharat Pankhania. Bharat, afternoon. Good to talk to you.
Good afternoon.
Well, we've got some idea of the government's thinking on how restrictions will be lifted. Are they getting it right, do you think?
Well, there's a lot of pressure by small groups of MPs. Getting it right equals not setting deadlines. And as soon as you start saying by the 8th of March or the beginning of April, I am going to do the following, it implies you are following a date rather than the data. And you've got to really follow the data. You've got to identify how it is performing, how well the situation is looking, and then make your adjustments rather than to set arbitrary deadlines based on a date.
Well, Boris Johnson is advocating a cautious reopening, but is it wise, though, to say the lifting should be irreversible when it happens?
Of course not, because you need to see how it performs. And if it performs in the negative direction, in other words, case numbers shoot up again, we have got transmissions and outbreaks of infections, you've got to do something. Therefore, to say, I want the restrictions to be lifted permanently is not the right thing, because you have to be honest and say you may have to reintroduce restrictions if it is not going in the right direction.
Is that, though, he's got such strong faith in the vaccine rollout that he feels he can make those sort of statements?
It's not possible, because even the best vaccine in the world cannot prevent outbreaks, because there is a lot more that happens once you've immunized, because you may get mild or moderate infection and be infectious and generate more cases. Therefore, whilst the vaccine prevents you from getting severe illness, it doesn't prevent you from being infected and infectious and therefore generate cases to people who have yet to be immunized.
Bharat, one final question. The hotel quarantine system begins today, but we've already heard concerns that the restrictions are too lax.
Well, we need to be more measured in controlling our borders. So whilst Scotland, for example, is saying universally, if you're coming from abroad, we need you to be in quarantine, whereas the England model is if you're coming from red listed countries. Well, a country may be green listed, inverted commas, for a moment, and it may shoot into red listed at any moment. So it's got to be dynamic rather than only the red listed countries. But also, I have concerns around a large number of people in a hotel setting. Have they considered infection control in such an environment? I am reminded of what happened in the Diamond Princess, where a lot of people were on board a cruise liner and transmission of infection was happening. Similar can also happen in densely occupied hotels.
Dr. Bharat Pankania, thank you very much indeed for joining us live on RTK.